ResFit today. Thank you for inviting me, and I'll be representing ResFit, which is an AOH undertaking. So who am I? Thinking, who's this person doing this presentation? Well, I'm a certified occupational hygienist. I'm a member of the ResFit board, and I actually lead the accreditation, the individual accreditation arm of that. I'm a member of the SF10 Australian Standards Committee, and we publish 1715 and 1716, which are the respiratory protection standards. In my other job, I'm the academic program director for OHS at the University of Wollongong, and not just an academic. I spent 25 years out there in heavy manufacturing industry, aluminium, paper, steel, heading up OC health and safety programs. So I've been where lots of you are sitting now. So what is ResFit? Okay, it's sort of a relatively new concept. It's a training and accreditation program, and our objective is to improve the health protection of those wearing tight-fitting respirators. So it's not about face masks, it's about tight-fitting respirators that need a seal around your face to provide the protection. And we want to make sure that when you're out there getting a fit test or you're employing someone to do that, that the person doing that test is competent. So how do we do that? We have a standardised training syllabus, which is based on the ISO standard 16975 Part 3. So we didn't just make it up ourselves. It's step by step from the international standard. And it provides a service to those wanting to do training courses so that they can go there, pull down the syllabus and follow that to set up a training program. So we get some consistency in that way. So we provide guidance also for workplaces. If you're out there and you don't know the first thing about respirator fit testing, where do I start? How do I set up a program? We can also, you can email resfit.org and we'll answer those questions for you. So what brought this about? Is it just a COVID thing? Well, not at all. We started setting this up as early as 2019. It's run by a team of volunteers like myself, and we've been working in the background with Breathe Freely program around silica and black lung, but the bushfires of last season and COVID have really, I guess, heightened the need for an accredited program and also brought it to people's attention. So because respiratory protection is the final line of defence for things like COVID, it's the first thing people often go to, we worked really hard to fast track this. We were online to launch in December, and we actually launched in August due to COVID and demand from the healthcare industry. So in the past, there's been no clear guidance on what makes a good fit test. Even some of the experienced people we've seen come through the program over the last few months have learnt things. I learnt things as I was putting this together, and that's really improved the community of practice for everybody. So who are we? There's 10 professionals who are the board of ResFit, totally volunteer organisation. We've also got a pool of experienced assessors. So once people have been through a program and they actually have been accredited themselves, then they can volunteer to be assessors in the program. It's independent, not for profit. Any of the funding, the costs associated with applying and going through the training or accreditation are fed back in to support the program, the exam platform and administration and so on. So we commenced in early 2019 and as I said, in a voluntary capacity. We've worked not just ourselves to put this together. We didn't just sort of dream this up as an isolated group. We had a lot of consultation with regulators, respirator manufacturers and distributors, and also trialled this out there in industry as well. So on legal obligations, you're thinking, oh, what do I need to do this? Do I need to go through this program or know about it at all? Well, as we all know, I think employers have an obligation to provide, a safe and a workplace that's free of risk to health and is safe. And when we go out and do risk assessments, we may, be required, or we may recommend putting in PPE either as an interim measure or in some cases, as a control measure that supports a higher order control. So when we provide PPE, particularly tight-fitting respirators, there are specific duties around that, and we need to make sure it's suitable size, fit, and reasonably comfortable. Australian New Zealand Standard 1715 outlines what a complete respiratory protection program is, and I want to emphasise, and probably preaching to the converted here, but you might want to show this to someone else, that it's got to be part of an overall program. It's not just I give someone a respirator, fit it to their face and send them off. You need, procedures around things. You need an overarching program. You need to educate people. You need to make sure that you've got competent fit testers and that the people using the equipment are trained and so on. And that standard will outline, and it's also on the ResFit website, that outlines your obligations, and I'm sure you're all more than aware of those. We've had instances where state and territory regulators have issued notices and fines where employers have not been able to demonstrate that they've got a respiratory protection program in place, and that also includes the fit testing. Particularly to date, we've seen a number of notices and fines around RCS exposures, silica exposures in stone benchtops, but we've also had some in healthcare settings here in New South Wales where notices and fines have been issued specifically around fit testing or lack thereof. So at the end of the day, ResFit's a good way to ensure that your people doing this are competent and that they're following standards and protocols, and it gives you some sort of confidence around it, and also, something to come back to if ever there should, be a legal issue. Hopefully not. So here's where you go for the information, respfit.org.au, and that's what the website looks like. You'll see across the top there's a whole heap of drop-down tabs. You might want to find a fit tester, find a training organisation. Could I just point you to the FAQs up here? So the FAQs, frequently asked questions, is a mine of information. So if you've got a question that I don't cover today or you can't remember, just jump in there, and it's all, divided up into, 15 or so different areas. So it's pretty easy to navigate. So just to reinforce why this is required, all tight-fitting respirators require fit testing. So it doesn't matter whether it's a disposable or a reusable or a powered air purifying respirator or a supplied air. If it relies on a seal around the face to get a fit and to get the protection, then it must be fit tested. So there's different ways of doing that. There's currently 3 major technologies that are used. There's the Qualitative, or people often call it the saccharin or the Bittrex test. It's a taste test, aerosol taste test. There's the Quantitative, which a lot of you would be familiar with in healthcare, using something like an AccuFit or a Porter count. And that's actually a condensation nuclei counting method. Why do I say that? That's because it counts the particles outside the respirator versus inside the respirator. So it's not necessarily a measure of concentration or filtration efficiency. It's around looking at the particles that go around the outside of the respirator. Then there is another newer technology, which is a controlled negative pressure, and it's really only applicable for your higher level respiratory protection. Just want to point out that we don't cover isoamyl acetate or banana oil or irritant smoke testing in Australia. We don't recommend those in the ISO standards either anymore. So what suits your style? We get a lot of questions around, should I do the aerosol taste test, or do I need to use, a Porter count or an AccuFit and do a quantitative test? There's pros and cons for either, and you need to work out, and there's some info on ResFit, work out what suits your situation benefits of the qualitative test is that you can still reuse the respiratory protection. So if there's short supply, that could be a good test, but then you have to disinfect the hood and so on. The quantitative is probably the most commonly used methodology. It's instrumentation's expensive, and you really do need to be a competent operator. It's not just plug the machine in and away you'll go. The controlled negative pressure, I just want to point out, is not possible to use that technology with disposable filtering face pieces. So how do you know what to do? So let's say you're using tight-fitting respiratory protection, which we are in most healthcare settings and hopefully in quarantine settings where there's a risk of contact with COVID people. So the first question really is probably for you is, will you conduct the testing in-house? Do you have a competent person? Yep, then off you go. If you don't have a competent person, then you might want to visit ResFit to look for an approved training provider to train people in-house. So nominate people, they complete the training, purchase equipment, and I know many of you have some equipment out there. And then the trained in-house person will conduct the fit testing using the knowledge that they've gained through their training. But I would just flag that it takes quite a while to become competent at doing fit testing to a level, you know, where we would deem professionally that you're competent to do the fit testing. So you'd really want to be under, I'd suggest, the supervision, you know, of a competent, experienced fit tester whilst you're doing this. You know, have someone that you can ask questions of, that can, you know, check out your work and support you in that. I mean, it's pretty critical that we get this right. So we'd also recommend that your in-house people undergo accreditation as soon as possible, that they're feeling that they're competent and ready to, because no doubt in studying for the exam, they will also learn more. They will pick up things that perhaps they were doing incorrectly or they didn't know. And it's also a measure of competence that you've got to support your OHS programs and you know, and show that you're doing due diligence there. So if you don't want to do the testing in-house, you go, my goodness, we don't have the resources, you know, we don't have that many people, or, you know, who knows how long we'll have to keep doing this for. You can visit respit.org, and there's a database of competent accredited fit testers. At the moment, there's a whole listing of people who are experienced. In a couple of months' time, that will come down and we will only have the accredited fit testers. So go out and engage a fit test service provider, and then they come in and do the testing for you. So just to give you an idea, this is the rubric, these are the requirements of a competent person to undertake fit testing. So you can look that up in ISO 16975, it's in part 3, section 5, or jump onto ResFit and it will outline those for you. So that could be a good checklist. If you do have somebody in-house who's being trained up, you can use this, you know, as a competency checklist, you know, for them to self-check or for you to evaluate as perhaps as a first step. So maybe you want an approved training provider. I think it's unlikely that in-house organisations, such as in healthcare settings or perhaps even in other industries, would want to, you know, be using their resources to go out and train others. But we have a lot of consultants out there and people who can come in and provide a service to us. And we want to make sure that their training packages are up to speed and cover a complete course syllabus. There's a whole program that that they need to go through. They develop the training materials, they submit the course materials. When all these things are submitted, they're actually reviewed by 2 different and independent evaluators. So that's done, you know, they're marked blind, if to use that terminology. Then that's brought together to a third party. So there's 3 of us across every application, whether it's accreditation or assessment. If it's satisfactory, great, they're approved. If not, resubmit course materials and address the gaps. It is quite an onerous undertaking, And we've had a couple of training companies that have gone through that already, and a number that are in the process of doing that. So once they're deemed an approved training provider, they then need to have accredited fit testers who are doing that. And we pop them up on the website, and you can go and have a look at that. So there's course learning outcomes if you're interested in what they are. If you're thinking, well, gee, I've had someone come in and do some training for me. How do I know that they're going to cover off the things that are required? So you can look at the course learning outcomes there if you're employing trainers. Remember that trainers, the providers are organisations, and then the trainer then is approved. 3-year approval, and it's up to the training company to decide how they want to deliver their training course, how long they want it to be, but they must have a minimum of 4 hours face-to-face practical component in there. And you can look them up on the website. So it's how much it costs for them to go through. They get if you do a training course, you get a certificate to say that you've, completed an approved training course. And then, you would go out and do your fit testing and so on and get more experience. So actually attending an approved training course, it's important to know that that doesn't make you a Respit fit tester. So we've had some inquiries around people said, oh, look, I've done an approved training course. Does that mean I'm now an accredited fit tester? No, it's a bit like, you're going to get your license and you've gone out and you've had some lessons, but you haven't yet, passed your driving test. So if you want to be an accredited fit tester and your competence evaluated, then you need to go through the Respit program individually. So how do you do that? Okay, we, apply to Respit, put in your qualifications. There's an online exam. It's a 1-hour closed book, and I see a couple of participants on the call today have already been through that. It's an online exam package so that it's remotely invigilated. It's closed book. It's a 1-hour timed exam, and we have an 80% mark as the pass rate, and that's pretty high. That sorts people out pretty quickly. So it's not a thing to go into without making sure that you've downloaded all the materials and read them and done some studying up before you attempt that. So let's say you pass the exam, you may need to resit the exam, and that's possible. Pass the exam, then you'd go on to stage 2, which is a practical video assessment. So because this is a practical undertaking, you need to demonstrate that you can actually conduct the fit testing. So you submit a 20 to 30 minute video that covers all the steps required in competently and successfully fit testing an individual. So you can resit the exam multiple times. The video assessment, it may be, you may have covered everything, and we go, great, you've covered everything. It may be that because, a couple of points weren't clear or you missed those. So then, we would go back to you and say, well, could you have another look at section 3 and section 7 and resubmit a video on that? Or if it's below a certain pass mark and it's just not that close, we would go back and give you a strengths and opportunities report for you to go away and redo and resubmit the video exams. It's quite a robust and onerous undertaking. Once you get through all that, you get a lovely badge here like this, and your details get added to the Respit website. I just want to flag that each individual, you'll see what methodology, whether it's the aerosol taste test or controlled negative pressure or the CNC, the port account one, you'll see what they're accredited to. So you might just need to do some double checking that you're, actually bringing in a fit tester who's accredited to the methodology that you're asking them to use. Okay, so it means at the point of time the person was competent and met all the requirements. It's up to the fit tester then to make sure that they apply those professional standards in all their undertaking. We're not, sort of a regulatory body or an auditing body that we're going to go out and do audits in the field. But if there is an issue, could I flag, if there is an issue with a Respit accredited training provider or fit tester, then please feel free to send an email to Respit. It would be treated confidential, all confidentiality. Send that through because, we want to follow up. We want to make sure it's a good experience and that you're getting what you've paid for. And we also have our professional association, Australian Institute of Occupational Hygienists, also has an ethics policy that we can hold people accountable to. So hopefully that won't happen, but it's there if you need to. So how much does it cost to go through accreditation is often a question. And if you've got people doing fit testing, you might think, oh, okay, well, if they're a member of our institute, it's $650. That's for 3 years. Or if you've attended an approved course, we've got a discount there because we're encouraging people to attend approved courses. And there's a discount there if you're a member of AOH. So here's the exam. I'll just go quickly through it because it's all there on the website. It's done on an ExamSoft platform. It's invigilated. They're conducted monthly, so you can jump in. You could book in and say, look, I'm going to book in for June. You might not be ready yet, but you can jump in and book ahead. And certainly complete a training course and download the syllabus and the info. Here's an example of how the videos come in. So we've got someone there conducting a fit test. You'll notice that the person being fit tested is standing, as they should be, and it's the person conducting the test that's seating. Just want to flag that. They pop in their video, load it up into ExamSoft. There's a time period to do that, and we review that, and then they get a nice certificate and card and badge. So just quickly, again, you might have companies come to you and saying, we have approved training courses and we have accredited fit testers. You just want to look, make sure that if you're ordering, paying for an accredited fit tester, that individual actually is. So there's rules around how people can use logos and so on. You might work for an organisation who thinks, wow, this is a really good undertaking and it's going to help the industry. You can become a partner. It's free to become a partner of Respit and have your logo added onto the website there, so you can contact us about that. You'll see that they're mainly regulators, associations and unions, that sort of thing. Whereas if organisations such as safety companies, safety supply companies, manufacturers and so on would be supporters, and that's they provide financial support to Respit for our website and admin and so on. So what's in it for you? I think I've pretty much already covered that. You get guidance. There's a great website there. It's an opportunity for an individual to be formally recognised and have their competence, documented or verified for their organisation. And for training companies, really, to align what they're doing to a recognised syllabus, improve. We've seen improvements in all the training courses that have gone through, given extensive feedback, and they've taken that on board. So that's really lifted the quality as well. So for more information, go to Respit or email us there. And I'll stop now because I'm way over time, and Kathy will need to move on.
Thanks.
Sorry, so if I can just stop that. Thank you.
We are having a lot of network issues, so